Hello, my name is Robin Shook from the Arnold School of Public Health at the University of South Carolina. I'm here today to tell you about my article, which has recently been published in the Mayo Clinic Proceedings, titled Moderate Cardiorespiratory Fitness is Positively Associated with Resting Metabolic Rate in Young Adults. I have several co-authors on this paper, including Dr. Chip Levy, who is a board-certified cardiologist at the Ochsner Clinic in New Orleans, Louisiana. I also have several co-authors from the University of South Carolina, including Dr. Greg Hand and Dr. Steve Blair. Today I'm going to tell you about a study that we have going on at the University of South Carolina titled the Energy Balance Study. And the purpose of the study is to determine the causes of weight gain, specifically looking at exact measurements of energy intake and expenditure. It's an observational study. We're following 400 young adults for 3 years, and every quarter during that 3-year period we take very detailed measurements of energy intake, expenditure, and energy storage. And so energy expenditure is measured using an arm-based activity monitor and also doubly labeled water. We measure energy intake using dietitian administered recall over the phone, and we measure energy storage using dual energy X-ray absorptiometry. Today I'm going to talk to you about one specific part of the study that we've been looking at, and that's the role of resting metabolic rate on obesity. And we're interested in resting metabolic rate for a variety of reasons. The primary reason is the majority of the calories that individuals burn throughout a day are from the resting metabolic state. About 60% of our calories come in that state. So for example, right now as I'm sitting here talking to you, I'm expending calories, and the determinants of resting metabolic rate are primarily our fat-free mass, and so that includes things like skeletal muscle and other internal organs such as kidney, liver, and the brain, which are highly metabolically active. And so we know that fat mass also plays a smaller role in resting metabolic rate, as does age and gender. But there still is about 25% of the variability in resting metabolic rate that has not been defined yet. And so we were interested in the role of fitness on resting metabolic rate and whether it explains some of that 25% variability between individuals. The manuscript that has recently been published uses baseline data from the Energy Balance Study. And so for this particular paper, we included 423 young adults and we measured their fitness using a maximal treadmill exercise test. And after everyone had completed the fitness test, we classified them into tertiles by their gender. And individuals in the lowest tertile were classified as having low fitness. Individuals in the middle tertile were classified as having moderate levels of fitness. And individuals in the highest tertile were classified as having a high level of fitness. Now, we took this approach because there is no widely accepted criteria for defining fitness. However, after the study was over, I compared our fitness categories to those of another large cohort study, the Aerobic Center Longitudinal Study, which has fitness data on over 50,000 adults, and our classifications of fitness closely aligned with their classifications of fitness. We measured resting metabolic rate using indirect calorimetry, and that is done when a participant comes into our lab in a dietary fasted state, so no food for at least 12 hours and no exercise for at least 24 hours. And we have them lie down in our lab in a quiet room, and we measure how much they're consuming, how much oxygen they're consuming, and from that we can calculate their energy expenditure. We measured their body composition using the DEXA scan, which I told you about earlier, and from that we can estimate fat mass, skeletal muscle mass, bone mass, and residual mass. And residual mass includes things like everything that's not skeletal muscle and bone mass, so other internal organs such as our kidney, liver, and brains. In addition, we measured energy expenditure using the arm-based activity monitor, and from that we can also get moderate to vigorous physical activity levels. We also measured energy intake using the dietary recalls. And so as you can see, as a whole, the measurements that we included in our study are extremely rigorous and of the highest quality. After statistically adjusting for differences between fitness groups for things like sex, race, and body composition, we found that low-fit individuals had a lower resting metabolic rate compared to high-fit individuals by about 60 calories per day. Additionally, low-fit individuals had a lower resting metabolic rate compared to the moderate fit group by about 40 calories per day. And figure 1 in our paper nicely displays this. It shows the 3 different fitness groups and the positive relationship between fitness and resting metabolic rate at every body weight that we have in our study. We also looked at moderate to vigorous physical activity, and it was also positively associated with resting metabolic rate. However, the effects were much more modest than those of fitness. So the primary finding from this study is that fitness is positively associated with resting metabolic rate in young adults. So not only did we see differences between low fit and high fit individuals, but low fit and moderately fit individuals. And that's the new finding from this study. Other studies had found that extremely high fit individuals, like endurance athletes, did have higher resting metabolic rates than sedentary individuals. But we have extended this by looking at not only high-fit individuals, but moderately fit individuals. And we are strong advocates of the role of fitness on health, and we feel it should be included in all studies that involve some sort of health outcome as a dependent variable. And as a colleague likes to say, fitness is important because it represents the resultant sum of numerous physiological systems. Now, energy balance and weight gain is very complex, and it is unknown what the long-term impact of RMR levels on obesity are, and we plan on extending or exploring those relationships further. But for right now, we can definitely say that fitness levels, specifically moderate levels of fitness, do cause elevations in resting metabolic rate. So, in summary, we found that fitness is positively associated with resting metabolic rate in young adults. Physicians should recommend all of their patients to obtain physical activity on a regular basis. In particular, for those trying to lose weight, they may see additional benefits beyond just energy expenditure. They may also see improvements in their resting metabolic rate. Now, the current recommendations for physical activity are 150 minutes per week. So that comes out to 30 minutes, 5 days a week. For those individuals trying to lose weight, they would probably see additional benefits at exercise up to maybe an hour a day for 5 days a week. And physicians should strongly encourage their patients to reach those levels of physical activity. So I would like to thank the participants in the Energy Balance study for volunteering their time, and I'd also like to thank the staff of the Energy Balance study for their hard work on the project. So on behalf of all my co-authors, I hope you enjoy the article. Thanks.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.